There's a lot of areas in which creative health can interweave and fit in, and I think it fits in with a lot of context within public health and creative health. Within any kind of setting, the plethora of public health outcomes across the 4 domains, I think it's having that open mind as a public health professional to the value that creative health can have, both on your work, but for everything, the citizens and the patients that you're serving.
The impact in terms of patient experience, potentially leading to reduction in length of stay, the impact that we know dance and arts activities on care of the elderly wards for dementia patients, where we see that really helping people turn the corner from deconditioning to a viable plan for discharge, and how a day of interaction can totally change the experience for patients and their carers.
Good health takes into account the people's ability to live more fulfilling lives. There's international evidence that tells us that the effectiveness of engaging in creative health programs is significant. Consider embedding creative health approaches because the return on the investment is significant, and let alone the impact that this can have on individuals, on communities, and on the population.
Creative health should be a central part of every strategy for improving the health and well-being of the nation. The evidence and the good practice across the country demonstrate the potential impact we could have through creativity. Perhaps now the time is right for us to implement a national strategy, delivered through the infrastructure of integrated care systems, backed by local government and arts organizations.
We all can tap into a creative heritage. We all understand how to move. We all respond to music. All of those things can influence how we think, how we behave, and who we are. Understanding and leveraging that will help really shift the dial from pure scientific intervention in health to a much more holistic way.